Hello, welcome to part 2 of Truenat hybrid training. I am Dr. Keerthivasan, microbiologist from Intermediate Reference Laboratory Port Blair of National TB Elimination Program. So in part 1 we saw what are the various aspects of a PCR, what are the things and steps of a PCR test, what is Truenat, and what are the different machines and equipments of Truenat, what are its different consumables, that is reagents, chips and cartridges. And we also saw how to process a sample from sample preparation, then DNA extraction, and then to run a PCR to obtain a result. Now let's see what all things we'll see in part 2. So part 2 we'll see the various interpretations of the results which we see in the PCR. Then we'll see what our NAAT test indications, that is we have NAAT test, that is Truenat and CVNAT, what are the indications for these tests. Then we'll see what are the routine follow-up tests. Follow-up tests, that means a person who is under treatment for TB, there are different regimens based on drug-sensitive regimen or drug-resistant regimens. What are the tests which are done during the course of treatment? Then we'll also discuss what is our current algorithm, 2021 algorithm for MDR TV, and then we'll see about other maintenance related things for TrueNAT, that is how to connect a new buffer pack once the buffer pack is finished. Buffer pack is the one which you connect to the end of your extraction machine, and it usually comes to a number of tests, that is around 50 tests, and after that you have to change the buffer pack, you have to attach a new buffer pack, and you also have to manually reset the buffer count. Then we'll see how to replace a spill tray, then how to do a slider glass replacement. Then we'll see what are the different types of errors and how can we do troubleshooting. And then we'll see what are the different steps to do for maintenance of these machines and also how to keep a maintenance log. Now coming to result interpretation. So the first test which we do in PCR is with MTB chip. With MTB chip you can get three different types of results. The first one is MTB detected. So here you can see MTB detected in this sample, and it also gives a rough estimate of how many colony forming units is present per ml. In addition to that, we'll also see this run status of this particular test is valid or not. So this tells us this extraction of this particular sample was proper and the PCR steps were also proper. So for this, as I already mentioned, that in the cartridge we have a processing control, internal processing control, which also undergoes all the steps of extraction, and PCR and detection as like the sample. So we know that there is no error during DNA extraction or during PCR. Next, you can get the result as not detected. So MTB not detected. The third result we can get is invalid. So as I told you, our internal processing control also has to undergo all the steps, and it has to become positive whenever it is negative. So when it is negative MTB, here you can see the blue color line, it is flag, but the control line has to be positive for the test to be valid and for us to tell not detected. If this control line does not amplify and we don't see this control line being picked up, so that means there is some problem during either extraction or it can be during PCR. So what should you do when you get this particular result that is invalid? So here you have to rerun with the same elute and using another chip. So here we are rerunning with the same elute which you got after DNA extraction. So to see that whether the problem is it during the PCR, that is why you are using another chip and rerunning the same elute. Okay. After that, if again we get invalid, so during the next test with another chip and same elute, if we get it as invalid, that means there is some problem in DNA extraction. There is some problem with the sample because of which the extraction has not taken place properly. So if you get invalid on repeat, you have to request for a fresh sample and then you have to redo the test. So once you know the MTB status that is detected, after that you have to do a RIF test. So that is done using MTB RIF chip. So here also you can get three different types of results. The first one here you can see is RIF resistant detected. Okay, so RIF resistant detected. Second one you can see RIF resistant not detected. Third one is indeterminate. So here indeterminate, that means the machine with all the data it has, it cannot determine whether RIF resistant is detected or not detected. This can occur due to low signal amplification and also mainly due to low number of bacilli which is present in the sample. If the bacterial load is quite low in the sample, then also you can get this particular result as RIF resistant indeterminate, especially like if you have sample load 10 power 3 and 10 power 2. So what should you do when you get indeterminate? So try to rerun the same elute with another chip. So again, if you get indeterminate, then write the final result as MTB detected, RIF resistant indeterminate, and sent to a higher laboratory, that is culture DST laboratory or IRL. Now, what are the NAT test indications? That is CBNAT and Truenat. So as we already discussed in part 1, that first the patient undergoes clinical screening, symptomatic screening, and after that he goes through basic tests like chest X-ray and sputum microscopy, and sometimes usually after that only he comes for this NAT test. Okay. So, but now we are moving towards upfront NAT. That is, people who are having these symptoms, who are presumptive TB suspects, they can be straight away offered this NAT test. So, NAT test is usually done at the time of diagnosis. The purpose of this is to segregate DRTB patients, drug resistant TB patients, based on rifampicin resistance status. So, we segregate them so that we can start appropriate therapy. Right now, as I told in the previous session, that therapy is divided into drug sensitive therapy, that is, first line drugs is given to those patients, and drug resistant TB, where different regimens are there for each scenario. So, it is not much useful for follow up, routine follow up. Why? Because this is a genetic test. So, it basically detects DNA, part of DNA, genes in DNA. So, routine follow up, it is not useful because when you are giving drug, the bacteria may be dead inside, but the DNA will be present in the sample. So even a dead bacteria which is present inside the body can give a positive NAT test. So that is why it is not done for routine follow-up. For routine follow-up, you want to know whether your drug is acting and the bacteria is alive inside, live bacteria. So for that, you have to do culture so that you can take this live bacteria, grow them and see its drug susceptibility. But there are exceptions. Okay. So during the course of the TB treatment, also NAT test can be ordered in certain conditions. First is during the course of drug sensitive TB. That is, at the time of diagnosis, they did a NAT, and that time they got RIF resistant not detected. And after that, it was sent to first line LPA. First line LPA was sent where they test for not only rifampicin and also for isoniazid. So in there, if they get isoniazid resistant, then that patient is put on H monopoly DRTB regimen. That means he's sensitive to rifampicin, but he's resistant to isoniazid. So those patients, during the course of treatment, some follow-up is done, some smear microscopy is done if it comes positive. So that time we want to ascertain whether the current status of rifampicin resistance has it changed or not. Though at the time of diagnosis, in both these scenarios, RIF resistance was not detected, but now because smear microscopy is coming positive, so we want to do NAT to reconfirm the current status, whether the treatment is working or not, or the RIF resistant status has changed or not, has it become RIF resistance detected now. Then both these scenarios, if there is clinical deterioration, if there is failure to respond to treatment, that time also NAT can be done. Then for patients who are retrieved after loss to follow-up, like more than 1 month, you couldn't track them. So there is high chance that these patients who might have been rifampicin sensitive initially might have become a MDR patient right now, as they have not been taking drug for more than 1 month. So it is always advisable to do a NAT test before starting the regimen again. Another reason is as per physician's advice, treating physician's advice, because they see the clinical progression of the patient. So if they require due to some reason, they can advise for a NAT test. Now coming to tests which are done routine for follow-up of different TB patients. So the first one is DSTB patients. So here the usual regimen is 2 months of IP and then 4 months of CP. That is, IP is intensive or initiation phase, CP is continuation phase. So here 2 months. So after end of IP and end of CP, the tests are done. Usually a smear microscopy will suffice. Sometimes you can also add a culture along with it. So during the course of treatment, also the test can be done, smear microscopy can be done if there is clinical deterioration. Long-term follow-up is done once after end of CP if the patient is negative for smear or culture, then the patient is said to be cured. But our program follows up these patients for long-term for next 2 years at 6 month interval. That is, they are followed up on 6th month, 12th month, 18th month, and 24 months. They will be screened for any clinical symptoms, either any reversal is there, the patient is now again showing signs and symptoms of TB, then again tests like smear and culture are indicated. Now, these tests are usually done for patients who are able to produce the specimen, and especially most pulmonary cases, the sputum. But there are situations where the specimen is not that easily accessible. For example, in young children, and also extrapulmonary cases. Okay, like you have TB meningitis or pot spine or lymph node. So all those sites, repeated sample is difficult. So those conditions, these are best assessed clinically by the clinician to see whether there is response to the treatment. Now coming to DRTB regimen. So first one here we have now is shorter oral bedaquiline containing regimen. Okay. So here we have a IP initiation phase for 4 to 6 months, and we also have a continuation phase of 5 months. So depending on the IP, the total duration can be either 9 months or it can be 11 months. So here smear microscopy is done monthly from third month onwards. So you may think that in DRTB, once we know the NAAT status, that is a RIF resistant, after that there is no smear microscopy, only culture. But smear microscopy is done monthly from third month onwards till the end of IP. And if you get any positive, within 7 days another smear is done so that to reconfirm the smear positive status. Culture is done at the end of third month and also at the end of sixth month plus at the end of treatment. So culture is sent 3 times. One is at the end of 3 months, at the end of 6 months, that is possibly at the end of IP, and also at the end of treatment or end of CP. So here also if any culture is positive, after that repeat cultures are sent till every month till it becomes negative. Then coming to DST, based upon our algorithm, first line or second line LPA and liquid culture DST is also done. Now coming to the next regimen, long oral MDR and XDR TB regimen. So here you can see the treatment duration is for 18 to 20 months. It's quite a long duration. So here also culture is done and microscopy is done with the culture at the culture and DST lab, not at the periphery. So here culture from monthly it starts. Here also it starts from third month, but it is done monthly till the end of sixth month. Sixth month, if you get positive, again seventh month it is done, and again eighth month it is done. Once you get negative in the sixth month or after that, then the culture test is done in a quarterly fashion till the end of treatment. So here also, based upon our protocol, first line, second line LPA is done, and also liquid culture DST is done. Now coming to our third group, that is isoniazide or H monopoly DRTB regimen. Here you have a treatment duration of 6 to 9 months. So here also you see at end of third month culture is done and then it is done at the end of treatment. Smear microscopy is done monthly from third month onwards till the end of treatment. But here you see DST, there is NAT. So that is the indication which we had discussed for NAT. Because H monopoly at the time of diagnosis, RIF resistance was not detected. So during the course of treatment, there is chance that if there is any clinical deterioration, it is due to rifampicin resistance. So NAT is done to know the status of rifampicin resistance. Then other LPAs are done. Then liquid culture and DST is done as per our algorithm. Now coming to PMDT 2021 algorithm. So there is proper guidelines for how to manage treatment and laboratory diagnosis of MDR patients, and which is revised every 2 years. So current guidelines which we are following is PMDT 2021 guidelines. So as per the guidelines, once the patient is Putam positive and you are sending for NAT facility, or even for upfront NAT when you are sending, you have to send two specimens. Okay, two specimens in 50 ml Falcon tubes, and it has to be sent in our proper triple layer packing under cold chain as per protocol. So in NAT facility, one specimen is processed, and if MTB is detected, irrespective of the rifampicin status, whether it is rifampicin resistant detected or not, if MTB is detected, then you have to send the second specimen has to be sent to culture and DST lab. So in the culture and DST laboratory, the second specimen is tested, and if on the direct smear, if it is negative, then the specimen is inoculated into liquid culture, and once it becomes positive, LPA is done. If the smear is positive, then direct LPA is done, and further tests are done as per the algorithm. Now, this is our consolidated algorithm. So, here you can see all TB patients, that is, all notified TB patients, have to undergo NAT. All patients who are not responding to treatment, non responders, then all presumptive TB patients also can undergo NAT, upfront NAT, and special populations like smear negative X-ray suggestive cases, extrapulmonary cases, young children, PLHIV patients, and also contacts of DRTB patients. So all these cases also you can straight away do NAT. So here, as you can see, first specimen is tested at NAT site, and once MTB is detected, irrespective of the rifampicin status, second specimen has to be sent to CNDS-T lab. Okay. So if rifampicin resistance is not detected, then sample is sent for UDST, where first line LPA is done to know whether isoniazid is resistant or not. If isoniazid resistance is detected, then the treatment is changed. The treatment which begins now is H monopoly DRTB regimen. So here, if rifampicin resistance is detected, then first line LPA again is done at culture DST lab to know whether isoniazid also is resistant or not. Then second line LPA and liquid culture DST is done as per protocol. Now let's see how to connect a new buffer pack. So as I told you, buffer pack is connected to DNA extraction machine, that is our True Prep Auto version 2 machine. So with that, usually you get original set of tubes to be connected to these buffer packs. So please keep these in a safe place and don't lose them. So here you can see this is our DNA extraction machine. So this is the place where you connect the buffer pack, and here you can see it is closed with a rubber lid. You can open the lid. This is the original tube which comes with the machine. So this tube is connected to different buffer packs, and once the buffer pack is over, you have to change it. So this particular set you have to keep protected. Please don't discard any part of it. So here you can see there are different caps for our buffers and our priming waste. These caps have holes and they go through these tubes. Okay. So there is a possibility that when you are handling this particular tube, the cap may fall off. The cap may fall off, but it is all right. You can always attach the bag because the tube contains those color beads. Here you can see the green color bead is here. Here you can see the blue color bead. Here you can see the red color bead. So even if the cap falls off, you can attach it at the correct particular tube. So you have to attach this particular end of this tube to our True Prep Auto machine. So you have to see that this is properly attached. This is properly attached. So here you can see this particular portion comes inside and it attaches. It should never be kept loose in this particular fashion, because then the buffer will leak and your test will not be done properly. So always check your new region pack is connected properly and tightly to the connector. So this is our new buffer pack. So usually with the cartridges you get this buffer pack. It usually comes for 50 tests. After that you have to change. Okay, so here you can see it comes with a cap. There is no holes. So these caps have to be replaced, and you have to insert the cap which is provided with the tubes. So here you see. So here all the caps are removed. All the caps are removed. And also kindly write the date at which this particular reagents are open so that you can keep a track of this buffer. So then after that you attach the tubes of the machine to the particular buffer. So you can see green color is attached to green, then blue color one you have to attach to blue, white to white, and red to red. You have to carefully attach. And once it is attached, you can keep it like this in this particular fashion. So now you have changed the buffer pack, but you have to reset the buffer count. That has to be manually done. So sometimes instead of getting the buffers in small bottles, you sometimes get like this pack, which has its own connector. This time you won't need our tubes which came with the machine. You can straight away connect this particular end of this buffer pack to the machine. So at that situation, you please keep our tubes in a safe place. Now, how to reset the buffer count? There are different methods. So after completion of 50 tests, okay, once your 50 test is completed, machine has counted 50 tests. As soon as you switch on this extraction machine, if you observe in this display, you will get buffer count. Okay, so the allowed count is 50, and as you keep the doing the test, the number will increase 1, 2, 3, 4, and when it goes to 50, it will stop and it will stop and you will get this particular display, that is change reagent pack and reset the buffer count. So here you have to press two buttons together, that is the start and eject. Okay, so this is start button and this particular thing is eject button. So here you can see both the buttons are pressed simultaneously, and once you press this simultaneously, then you will get the buffer count will be reset to 0 and settings will be saved. So this can be done after completion of 50 tests. If you attempt to do this particular step, that is pressing both, when your number of tests has not reached 50, then this reset won't occur. Okay. So this test to be done only after completion of 50 tests when you get this display, change reagent, pack and reset buffer count. Then another method is there where the machines which have this QR code scanning enabled, or machines which we have in our UT, this particular feature is not enabled. So in the machines where this QR code scanning is enabled, they can use a card. There is a reset card which comes with the pack. This card can be put in the place of the cartridge. Okay, this card can be put in the place of the cartridge and you can press play. So after that, it will read the reagent reset card. Then it will automatically reset the buffer count to 0. Okay. So we don't have this particular facility enabled in our machines right now. Then the third method is manually change the buffer count before the completion of 50 tests. Now, why will you do that? Okay, before the completion of 50 tests, say something happened to your buffer pack, or you have to change the buffer pack in between 50 tests. Like now you have used a buffer pack and it has given, you have done say 10 tests, but you can change it only when it is 50 tests, isn't it? So, but due to some reason now something happened to your buffer pack, or you have to transfer this machine to another site where they will be putting a new buffer pack. So that time you have to reset this count to 0 again, but you have not achieved the 50 test. You have not completed the 50 test. So that time what you have to do, we have to go to the service menu. So before that, first you have to switch off the machine. Okay, first switch off the machine. Then you have to long press start and power button simultaneously. Okay, so start and power button on both the sides. You have to press them simultaneously and you have to hold the buttons till you get menu option. Okay, so it will start and you will get this particular display, that is menu. Once you get this particular display only, you have to lift your both the fingers, and after that you can use the middle button, that is the eject button, to toggle the menu. So you can see in the menu the first option is flush, which we won't be doing now. So if you press this eject button again, next option will come. Now here you can see the next option is reset buffer. Okay, so reset buffer. So now you press the two buttons which we had used to reset before, that is the play and eject. Okay, so play and eject button is pressed simultaneously, then the buffer count is set to 0 and the settings is saved. Okay, so this is the third method and this can be done before reaching 50 tests. Okay, on special situations which I mentioned. Then to come out of this service menu, you press eject and toggle to exit. Okay, so now after this thing, the option you will get is exit. Then once exit option comes, then you press the power button to select that option and it will come okay. Now your buffer count is reset and you can use the machine. Now let's see what is spill tray replacement. So the place where you put the cartridge, so you load the cartridge here. So here you can see below the cartridge there is a tray, there's a plastic tray, so that if there is any leakage or any contamination, it can collect at the bottom of the cartridge. So there's a plastic tray, see. So if there is any leakage of liquid and that particular area is contaminated, you can take this plastic tray out and discard it into 1% sodium hypochlorite solution. And if any other portion of this place where you put the cartridge is also contaminated, please use 70% alcohol to wipe that area. Then take out a new spill tray. Then you can insert it in this particular fashion orientation. And it will be like a small bench inside where it goes and fits. And then after that, you can start using the machine for the test. Now we will see how to replace the slider glass. So this slider glass is actually present in your PCR machine and all the readings are taken through this glass. So after certain number of tests, the transparency of this glass will be affected, so which can affect the readings in the PCR machine. So our program NTP and Central TB division recommends that this slider glass has to be changed after every 200 tests. So once 200 tests are done, then this slider glass has to be replaced so that we get reliable results. So first select the module. If you have a duo machine, you will have two chip trays. So you will have two slider glass. Both has to be changed depending upon how many tests are done on that module. So each module after 200 tests, you have to change that particular slider glass. So here you don't select any assay. So you just click on open tray option. Then your chip bay will open. So here you can see there is a slider glass. You can use any tweezer or forceps and you can remove the slider glass. So this particular glass, as you can see, the transparency is not that good. So now we take a new slider glass. So please hold the slider glass from side to side only, okay? So we don't want to introduce any fingerprints or any dust on the top or bottom portion of the slider glass, which will interfere with the PCR reading. Then with the help of the tweezer, you can remove this protective plastic layer. So like you have used tempered glass for your mobile or scratch guards, which have this protective plastic layer on both the sides. This slider glass also has this protective plastic layer on both the sides so that there is no scratch or any dust or fingerprints at the time of installation. So remove the plastic from the other side. Now you can insert. So there is a groove, it will just go and it will sit there. There is no clicking or anything, you just have to place it. And once you have placed it properly, just press the close tray option. And now your machine is ready for use. The cartridge which we use for DNA extraction has some rubber washers. Okay. So it is present in three places. Here you can see on the top here, and here again one, and somewhere here there is another rubber washer in three places. So sometimes what happens after you finish the DNA extraction and you discard the cartridge, this rubber washer is stuck to these particular nozzles, and when you insert a new cartridge, what will happen? That cartridge will not load properly. So then you can get errors in DNA extraction. So for that particular reason, kindly check that these nozzles are free of any rubber washers. Now let's see what are the different types of errors. The errors again, you get different sets of errors in our DNA extraction machine, that is TruePrep Auto version 2, and also in our PCR machine, PCR analyzer. So first we'll see what are the different types of error which we see in our extraction machine, that is TruePrep Auto V2. So first error is cartridge valve error. Okay, cartridge valve error. You will be displayed E1. So here what has happened? The cartridge which we use, it has different valves. That valve is damaged. So there is something problem with the cartridge. So what we have to do? You have to do the test again with a new cartridge, because this particular cartridge there is a problem. So you have to start afresh. That is, now you have the sample, isn't it? From which you added 0.5 into a lysis buffer, and that all the lysis buffer 3 ml you have put in a cartridge, but that cartridge is defective right now. Okay, but now you still have the sample. Now you take a new set of lysis buffer, again take 0.5 ml and put in the lysis buffer and do all the steps, and after this load that sample into a new cartridge and then do the test. Okay, then we have error 2, that is cartridge error. So this is due to pressure drop. So here again the cartridge, you see there are different tubes. So if it cannot maintain the pressure and there is pressure drop, error 2 will occur. So in this also there is a problem with the cartridge. So both E1 and E2, what you have to do is you have to start afresh. That is new set of lysis buffer. Then from that step you have to proceed with a new cartridge. Now coming to error 3. Error 3, the problem is with the sample. Okay, the sample is too thick. Okay, liquefaction did not occur properly. The sample is too thick. Then what happens? You will get this error 3 where the cartridge is clogged. As you see, has so many tubes. If it is too thick, it will go and block these tubes. So you have to always ensure the sample is fully liquefied and pipetable when you do the test. If the sample is very thick and you cannot do the test, you can always request for a new sample. Then coming to error 6, cartridge not loaded, cartridge not detected. So as previously we were discussing that the cartridge will not load properly if these rubber washers are present in those nozzles. So you kindly check if you are putting the cartridge in the proper orientation, and those nozzles, do they contain any leftover rubber washers. So if these washers are present, kindly remove them and discard them in 1% hypochlorite and then load the cartridge in proper orientation. Then after that we have error 9, error 10. So these are actually reset card related error. We don't use reset card here. Then we have error 11 and error 12. These are problems with heater plates. Okay. So here you can see both the sides, that is the lysis side and elution side of the cartridge. There are heater plates. So these are heater plates. So there is some problem with these heater plates. The temperature is not maintaining. That time we will get E11. E11 we will get for lysis side heater plate error, and E12 we will get error for elution side heater plate error. So during these particular errors, that is E9, 10, 11, 12, you have to contact MolBio support for any further action. And if any of these errors occurs repeatedly, kindly contact your supervisors, lab supervisors, or your IRL microbiologist who will assist you in further troubleshooting. Now, other than this error, that is E codes, there are also W codes, that is warning codes. Okay. So W1 is SBC not responding. Here you, again all the warning codes you have to contact MolBio support team. W2 unable to read cartridge, again you have to contact MolBio support team. And W3 here is low battery. Okay, warning is coming low battery. If the battery is low, you will have this low battery blue color light indicator which will glow. So you have to charge the battery properly and then only run the device. Now we saw the different errors in extraction machine. Now we'll see what are the different errors which we see in PCR machine. Okay. So PCR machine, we have different types of error. Error 1, error 2, error 3, error 4, error 5, and the invalid result which we already discussed. So error 1, 2, 3, 4, 5, whatever it is, the main thing which we have to do troubleshooting is you have to rerun the sample. That is the elute which you already have after DNA extraction. You have to rerun the test using a fresh chip. Okay, fresh MTB chip if you are using a MTB chip, or if the error is in a RIFS chip, you have to use the RIFS chip. You have to rerun with a fresh chip and then do the test. So now let's see what is error 1. Error 1 is thermal cycling error. Error 2 is test stopped manually. Then we have error 3, incorrect optical profile. Error 4, runtime error. Error 5 is probe check error. Then invalid, as I already discussed, the internal control, it did not undergo proper extraction or it did not undergo proper PCR steps. So in invalid, as I told again here, like the similar error, like the previous errors, here again you have to rerun the same elute with another chip. But if in that chip also invalid, you get invalid, then what do? Then you have to get a fresh sample and process with a new set of chip. Then here you get certain alert messages, for example, unable to read chip information. So here you have to see whether the chip you have placed in the chip tray has it been kept properly. If not, remove the chip and then reselect the profile and again do the test. And if the message reappears, then do the test with the new chip. Could not initialize, please try again. There is some problem with the internal connection. There is the chip has so many golden plates which you can see the connectors. So if, as I told you, you have to hold the chips on sides, you should not touch the golden plates. If there is any corruption on that area, the internal connection won't occur. So then you have to take a new chip and reload using the same elute again. And if by mistake you have left the chip inside the previous chip and if you without loading the new chip, if you press start test, then also it will give option like chip which is loaded is already used. Now coming to maintenance. So like our CBNAT, Truenat also has a different set of maintenance and there is a maintenance schedule and a logbook which has to be maintained. So this is broadly classified into daily maintenance and monthly maintenance and annual maintenance. Annual maintenance is usually done by the company, that is Malware. So daily maintenance, the workbench has to be cleaned. So here you clean with 70% alcohol, either ethanol or isopropyl alcohol, clean the work area. You have to discard the used chips. Daily, whatever chips and cartridges you are using, that has to be discarded in 1% sodium hypochlorite. Then you have to fill the maintenance log. Daily, it has to be filled. Then coming to monthly maintenance, you have to disinfect the instrument surfaces, the top surfaces, okay, of the instrument. So company recommends 1% sodium hypochlorite, and after that you have to clean with a clean cloth. Sodium hypochlorite, as I mentioned, is a little corrosive chemical. It can damage the equipment if you don't clean it soon after. So either I would recommend you can use 70% ethanol for cleaning the instrument, and also the TrueLab base, that is where you put the chip, this particular area. This also has to be cleaned. Can clean it again here with 70% alcohol. Temperature calibration, this is done with a different set of chips which the company provides. So this again we'll do annually and it will be done by the company. Now annual maintenance is usually done by Malware. Otherwise, if necessary, if we have to troubleshoot from our end with the assistance of Malware, these steps are done. So our first one is flush protocol. So the tubes set which we saw for buffer. So what happens? These buffers are usually liquids which contain some salts and chemicals inside. So on multiple usage, what will happen? This salt may get deposited inside the tubes and it can block the tube. So at that time, we have to flush. Okay, any tube gets blocked, what do? You flush it, isn't it? So also this protocol can be followed. Like if you're not going to use the machine, say for the next 10 days, you can flush that particular tubes and then you can leave the machine to rest for the next 10 days. So here they use distilled water as the buffers and also they use distilled water as a sample in a cartridge to complete the flush protocol. Then comes pillage tray replacement, which we already saw. Then slider glass replacement. So slider glass replacement for every 200 tests. Temperature calibration, as I told you, it is done with a particular set of chips which are supplied by the company. Now we know that all these three machines, that is the DNA extraction machine, the PCR machine, and the printer, all are battery operated. So, but I will advise that when you use the machine, keep the wires connected to charge and keep it in charging as possible when you do the test, though it can do the test on battery. And these take different times to charge. For example, the PCR machine usually takes 4 hours to fully charge, whereas the extraction machine takes a longer duration, 9 to 10 hours, and the printer takes 4 to 6 hours to fully charge. These batteries are expected to have a lifetime of 5 years. Now coming to the maintenance log. So maintenance log has to be maintained and has to be updated daily by the concerned LT. So the LT can put his name here, and when during on-site evaluation the STLS comes and reviews this particular site, he can sign here. And the medical officer in charge can sign here. They can write the particular month, okay, say Jan 2022 of this particular log. So each month a different log has to be placed. Then you can see the maintenance activity and you can see the days of the month here from 1 to 31. So for example, daily maintenance, so we have clean work area that is with 70% alcohol. So once that particular test is done, say for January 1st, it is done, the LT can put his initial here. For example, if LTA, he can put his initial here. So this particular LT has done that particular test. So for example, there are two LTs here. So they can, whoever does this particular activity can put their initial here. So for example, first day LTA did, then second day LTB did, or third day again LTA was on schedule. So as per the roster, whoever does, they have to put their initial here. Same for discard used chip cartridges. So these two things are done for daily maintenance. Then coming to monthly maintenance, that is disinfect instrument surfaces. The day which this disinfection was done in January, the month of January or whichever month, you write the day and whoever did their initial. Okay. So I recommend you do with 70% ethanol. Then coming to clean TrueLab base, that has to be done monthly. Again, the date and the initials. So this the company recommends to do with 0.5% sodium hypochlorite and then immediately clean it with water. So here again different concentrations of sodium hypochlorite. So here also you can use 70% alcohol to clean that particular area. Then you have temperature calibration. This, as I mentioned, though it is written in monthly, but it is done here yearly by the company. So date of last temperature calibration you can write when the company does that particular service. Not only that, the next most important thing here is pipette. Okay, true prep precision pipette which you get that has a fixed volume of 6 microliter. So that also has to be changed every 6 months. So every 6 months that particular pipette has to be changed, because once you use a pipette for long duration, you keep pressing it, then there will be some change in that pressing mechanism, and we have to ensure that only 6 microliter is collected. So then this pipette has to be recalibrated. For that purpose, our program recommends that every 6 months these pipettes are replaced with a new set of pipettes. So date of issue of pipette also you have to write so that you can track this particular change, so that after 6 months you can change this particular pipette. Then as necessary, whenever this flush protocol is done, you can write the date, and spillage tray replacement is done, and slider glass replacement after 200 tests. So whenever you do a slider glass replacement, write the particular date, okay, so that after 200 tests, then you can replace this particular slider glass. That's all for part 2 of this training. In part 3, we look at other aspects, that is how to maintain a lab register for Truenat, and how to maintain stock registers, how to compile monthly indicators, and how to check all the details in sample registration form. And once the results are obtained, how to update the same in Niksha. All this we'll see in part 3. For post test, I'll be sending a link of Google form in our WhatsApp group. So kindly click the link. In one of the questions, your name will be asked. Kindly type your name. All the other 10 MCQ questions will be there. You can select your option. So at the end of selecting all the options, you can press submit. After that, you can view your result, and also you can see if you have made any mistake and what is the correct answer or response for that particular question. I've also attached some training documents which you can retrieve through your Echo accounts. So thank you for now. We'll meet for our next session. Thank you.